Welcome back to Voices in Health and Wellness. This is the podcast where we explore what's really working in today's rapidly evolving health landscape, from functional medicine and mental health to tech-driven solutions, reshaping the care experience. Today's guest is someone doing truly transformative work at the intersection of psychology, AI, and access to care. I'm joined by Dr. Ayelet Hirshfeld, a clinical psychologist, psychoanalyst, and the driving force behind PsyEcology Inc, an ethical AI platform tackling one of the biggest challenges in therapy, client dropout. So with that, Ayelet, I'd like to welcome you to the show. Thank you so much for joining us today.
Thank you so much. It's a pleasure to be here. So as you've mentioned, I am the founder and CEO of PsyEcology Inc. It used to be called Your AI Psychoanalyst. We just changed the name to be more inclusive. And for a decade, I've worked clinically. I work in advisory capacities in the intersection of psychology, psychoanalysis, trauma, technology, and human behavior. And I am very, very interested in the clinical reality. So what brought me here is not really academic background, but more sitting with patients and realizing again and again that therapy doesn't usually fail because people don't want help. But it often fails because the system doesn't support getting the right person to the right clinician at the right time.
Got it. Okay. If we could perhaps rewind a little bit and just maybe start with your sort of journey to where you've ended up and what sort of inspired you to do this work and specialize in the psychoanalysis and the psycho specialities that you do, just so we have some context for who you are, where you've come from.
Yes. So I've earned a PhD from Alliant International University. I've completed a postdoc at Stanford and my analytical formation at the Lacanian School of Psychoanalysis, as well as a healthcare executive program at UCL's Business School for Health. And that really allowed me to zoom out and be able to look at the system as a whole. Really with a decade of experience providing care to patients, working in different systems, both in private practice and community mental health. And I was really able to look at the difficulties, challenges that mental health care is facing, and be able to integrate and think about how AI can help transform and better patients' experience and clinicians' experience at the same time.
Thank you. Really helpful for that context. So let's start with the challenge. You just alluded to it earlier on. Why is early dropout such a persistent issue in therapy? I think you mentioned about the matching and it's getting the right therapist. Are there any other aspects to this?
So in practice, usually it shows up as people starting care with motivation, and then they struggle to continue. Not because therapy can't help, but because the fit isn't right, the process itself is too fragmented. And so if you think about it in the medical field, imagine you broke your hand and you're then matched with a gynecologist. And so there are doctors that and you really need help, but these doctors do not specialize in the care that you need. And so many people cycle through multiple therapists before something clicks. And each time they have to retell their story, open difficult material, rebuild trust. And for a lot of people, especially during crisis, that's not sustainable. And then on the other end, there are the clinicians that are overwhelmed with screening, intake, administrative work, and coordination that takes up a lot of time and energy and contribute to burnout and workforce strain. And so this problem lies on both the client side and the clinician side, and this is what really led me to found PsyEcology Inc. And as I mentioned, before, both private practice and large systems or community settings, in private practice, dropout is generally lower than what we see in large systems or community settings. And that's because clinicians have more autonomy, they can assess fit informally, they aren't rushing intake, and continuity tends to be much better. The psychologist is responsible for scheduling the sessions. Clients that are seeking care in private practice are more knowledgeable about their needs and the particular qualifications of the therapist they're seeking or the conditions they're seeking treatment for. Dropout becomes a major crisis at the system level, especially in public system, insurance-based care, large platforms where matching is seen, intake is rushed, and people are treated interchangeably. And so then scheduling is really handled by a dedicated team who are not familiar with each clinician's specialty or the client's specific needs. And this is a major problem, and I can go more into the numbers both in the US and the UK in terms of the burden and the really significant estimated burden each year annually on the government spending.
Yeah, really interested in that burden. And I just wonder how much of this is a personality of the client versus the practitioner, and how much is it that is the wrong approach, or is it a combination of the two? Or is sometimes the personality fine, it is just the approach that's wrong in your experience when you were researching this to come up with the platform?
So we know that in psychology as a whole, in psychotherapy, there are many variables that we cannot really fully explain or predict who will do better and with which therapist. There is on the end of the qualification, there are specific issues, problems the clients present with, and where clinicians basically are not qualified to treat. On the other end, there is, as you said, the personality of the clinician, the personality of the therapist. And we do know that 50% of the variable that we cannot account for is exactly that attunement and that personal connection to a therapist that you can relate to, which is why in psychology we created an AI native mental health platform that streamlines therapist-client matching, which we call ANA, and it's composed of two core components. One is a therapist-client matching algorithm, and the other is a virtual therapist persona agentic system. And so basically that addresses that particular issue because it builds therapist personas that mirror each clinician's style and enable clients to interact with the therapist persona agents before booking. And it is built to enhance the human expertise. So again, unlike static platforms like Psychology Today, ZocDoc, we offer a dynamic AI-driven engagement, which is not a listing only of clinicians and expertise without the client therapist fit optimization. And so this personalized AI matching therapist persona agent allow this continuous engagement, and they really do focus on reducing the friction at entry into care instead of relying on explicit self-report, such as what kind of therapist do you want. It really incorporates implicit signals of how people communicate and respond to structure of feedback, pace, tone, and relational style. So it will give you a sense of how that clinician relate, how that clinician communicates. And because these therapist personas are trained by each clinician and they reflect the clinician's real style and areas of expertise.
Fascinating.
And so the purpose is not to simulate therapy, but to let clients get a grounded sense of what it would feel like to work with a therapist before booking.
Do you have any sense of, we're talking about come back to the burden again, how many sessions is it taking clients to realize in the old sort of system that they're with the wrong therapist? Does it take more than a couple of sessions? I mean, do clients spend months in therapy before they realize this is not a good match? Because I can see this being a huge problem that your thing could solve, but I just want to really get some sense of what that burden really looks like.
Yes, definitely. So this goes really into the heart of the problem we're trying to solve, because this unmet need is really enormous, both in the US and the UK. So if you look at the United States, around 59 to 61 million adults meet criteria for some form of mental illness in any given year. but only about 52% receive treatment. So it basically means that half of the people who need care are not getting it. And even among those who enter treatment, dropout, as you say, especially early dropout, remains really common. And usually it would happen within 1 to 2 sessions that 50 to 65% of clients will drop out of therapy. This is a staggering number. And again, we're talking about large systems, large health systems, and it's a systematic problem more than a private practice problem. And this leads to, for example, out of the total US health spending of 4.9 trillion, the total mental health spending is 225 billion annually. And the indirect economic burden has to do with, loss of productivity, disability, unemployment, and medical comorbidities estimated at 300 to 500 billion. So this is the problem that we are trying to solve, which is indirect economic burden tied to individuals not receiving mental health treatment when they need it. And the numbers in the UK are 1 in 4 people experience mental health problem in any given year. And over 2 million people are waiting on waiting lists for NHS mental health services. Many wait for months before they start receiving treatment. And again, this leads to significant indirect economic burden of about 100 to 150 billion pounds annually. That has to do with productivity losses and quality of life impacts.
Wow, it's a very worrying statistic. So talk me through the platform from the perspective of a new practitioner who's registering on the platform. What does that whole training thing look like? How does the platform get to know what they're like, how they operate, and create a persona?
So the clinician will interact with a client simulator to create their virtual therapist persona. And that will be based on, there is proprietary information there that I cannot go into the details, but they will train a virtual therapist persona that showcases their knowledge, their expertise, their relational style, and it will allow clients to interact with. And clients that will join the platform will be matched based on the therapist client matching algorithm, and will basically be introduced to therapist personas that meet the criteria of the problem they're seeking help with, and will be able to choose in a very precise way a therapist that they can relate to, a therapist that really does meet the criteria for the problems they're presenting with, that has the qualifications. And again, the idea is to really prevent that early dropout rate of 50% at the start of therapy, so that clients who do not have a good experience with a clinician early on do not endure this problem, are being matched, and receive treatment, proper treatment. We do know that clients that have a bad experience might never return to treatment. And so it's really key to be able to address it at the start.
I hear you. So from a client perspective who's registering on the platform, without having to give away too much, because I know it's proprietary, what does that intake process look like? And what are they seeing? What's the output? Are they reading things? Are they seeing an avatar? What does it actually look like to a client?
So they are actually asking questions and speak about what help they need. And they're interacting and speaking to the virtual therapist persona online. And so they can ask any question they want. They can ask about how the therapist will approach their different issues, how they interact. They can ask about their expertise. They basically ask any question they want and are able to speak to that right now it's by writing. but are able to communicate with the virtual therapist persona.
And so far, do you have any kind of preliminary results of how this is working out?
So we are really only at the MVP stage, and we have not opened the product yet to a closed beta, which is what we are doing very soon, what we're going to be doing very soon.
Got it. So you're kind of in beta, I guess, at the moment.
We're still in the development phase, and we're almost done with the MVP.
And in terms of when this does get rolled out, will this be the therapist that will be funding themselves to be registered on the platform, or will it be the client paying for the service? I'm just trying to get some understanding of how this will get funded.
In terms of the go-to-market, the burden will be on the therapist side, on the system side, whether it is an individual therapist or a bigger organization, not on the client side.
Okay, thank you. So you've got fairly deep roots in psychoanalysis and trauma work from your background. How do you see that integrating with innovation and tech going forward?
Well, the way that, part of my role is not only as the founder of PsyEcology Inc., I also advise different organizations as a health consultant, as a trauma expert, and some organizations within the area of AI and mental health, and some not. I really see AI transforming mental health care in a very, very significant way. I think that it's going to answer many different problems and be able to help with the problem of discontinuity of care, fragmentation between mental and physical health care, the rising exposure to chronic stress and trauma, from economic pressure, climate-related events, social instability, which all increase demand while straining limited resources. And I think that, as a mental health clinician, I see that trend of practitioners that are really adapting AI across mental health care. What we see mostly right now within AI is focused on reducing administrative burden, things like transcription of sessions, automated note-taking, documentation support, billing, scheduling, which is really, really important to reduce clinician burnout, free time, and allow therapists to focus more on clinical work rather than paperwork. But what's relatively still undeveloped or underdeveloped is AI systems that address the relational and structural challenges, how people are matched to care, how continuity is supported, and how we prevent early disengagement. And this gap is where I see the next phase of meaningful innovation that needs to happen. And so, again, when you look at it, matching is not really a clinical intervention. It is a clinical intervention. It's not an administrative afterthought. And ethical AI should and does reduce friction and give clinician time back. It does not replace their judgment, does not replace their care. And so this, I think, answers a very big question. And I think that this is something that a lot of clinicians are worried about, and not only clinicians. And the question of, can AI replace therapists? And I think that we need to change that question and look at how AI can strengthen, can really make the human care stronger and not replace. And so if we do it right, it can really better care. And that's why we built Anna, which is the system of matching clients and therapists, and to be able to, again, not replace therapists, but better support care.
Thank you. So you talked a lot about ethical AI and how that can benefit, things like client and therapist matching and streamlining some of the operational things behind the scenes. But let's talk a little bit about unethical AI, because there's been a lot of stuff out in the media about how AI is being used to give therapy, which obviously that's something you probably don't approve of. But what are some of your concerns around AI in the wider sense?
Yes, well, we've seen some examples in the news of different platforms where the safeguards were not yet there, I would say. I think that it is getting there. And clients that interact, not clients, but individuals interacting with these platforms, asking questions such as, how can I harm myself? Where these platforms would actually give them instructions on how to, and will fail to flag serious harm. And I think again that, as you say, the question of ethical AI in these instances, AI can cause harm, but it's not so much the system itself, it's making sure that there are safeguards in place that are being adapted. And the question of educating the public, educating them that AI is not, it's not a therapist. And the problem that we're facing, that individuals are going online and are using all of these platforms, whether it's ChatGPT, Gemini, for mental health, which is a phenomena that we cannot really prevent, right? Aside for educating the public and having safe guards in place that will flag, for example, suicidality, homicidality, and really redirect you to the right resources and educate the individuals that this is not instead of a therapy and they should reach out to a therapist. And so these are, I think that this is where a lot of the work lies ahead. And yeah, this is an issue we're, I think, all facing.
So ethical AI is clearly moving at pace, and obviously your platform is going to be doing huge amounts to improve the matching and the efficiency of a client-therapist interaction. Is there anything in mental health care that you don't think is changing fast enough from your experience?
I do think that adapting AI to better mental health care, to be able to really address these different facets that the mental health care industry is suffering from, and it's not adapted fast enough. I think that it requires a lot of education within organizations, as we see AI being adapted in organizations outside of mental health care. And I do think that, clinicians are wary of technology, and there are a lot of legitimate fears. At the same time, that it can really provide very, very significant insights and be used responsibly and ethically to better mental health care treatment, make sure that it's more precise and produce better outcomes.
Thank you. So obviously you're involved in a number of different things, clinical practice, the various platforms, and the platform is in development. What are the things that are going well from the point of view of developing this that you're sort of proud of, happy? Just curious to know.
Yeah, well, it's been a very fascinating journey. I think that, it is, I think that it's a very significant addition, innovation that we're introducing. That is a problem that is often overlooked. To be able to really focus on that and come up with a product that answers, that fills that gap, has been very fulfilling. And as a clinician, as a clinical psychologist, as a psychoanalyst, you do a lot of meaningful work, which I'll always keep doing, one-on-one, seeing clients, which is a work that I love. But at the same time, your ability to make a big impact on society is more limited. And so I do engage in different things, such as being an editor of a psychoanalytic journal, being able to advise organizations, consult organizations to make a larger impact. And with this product, I really hope that the reach and the impact that I can have to better improve mental health care will be more significant, which is a mission, that a sense of a mission that I'm on.
Thank you. And on the other side of the coin, What are some of the challenges in, one, getting a platform like this off the ground, but also the challenges of patient-facing work and all the other things that you're involved with clinically?
Well, it does take a lot of compute power, and so there are significant financial costs associated with that. At the same time, this is exactly where we are, and where we are in terms of launching the product, seeking funding to make sure that we can continue development at the pace that the pace that it requires. And the other question had to do with my other roles or clinical practice. Can you?
Just in general, the things that are the most challenging at the moment or frustrating in the work that you do. I'm just curious to know what that looks like from your perspective.
Well, that's an interesting question. I would say that I always look at frustration or challenges as opportunity for growth. I always keep learning, and I do. Again, the work is always challenging. It's always intellectually stimulating, and so I would say that one thing that comes to mind that is very, very significant in my work is events that happened globally, such as October 7th, for example, and being able to really help and support different organizations that are helping and providing support for individuals affected by these tragic events. And I am a consultant to the National Institute of Neuropsychological Rehabilitation in Israel. And so that really allowed me to integrate my knowledge in trauma and help support programs, again, that specifically help support survivors of October 7th. And that is something that's very meaningful. Of course, it is a very, I would say it is a very emotional topic as well, being Israeli myself. And so, this is, part of responding to real events happening during real times and being there to support clinicians who are doing the work in the field.
Thank you. And that leads me nicely onto my question about burnout. So in a field with so much burnout and overwhelm, how do you stay grounded? So both professionally and personally?
Well, I give this advice to a lot of clinicians to make sure that they take good care of themselves. And I practice a lot of different sports, yoga, Pilates. I think that's really, really important to take good care, good nutrition, make sure that you prioritize sleep so that you're able to be focused, sharp, and feel well yourself. And this is part of what I advise organizations as well, to make sure that the organization is healthy. And I also consult to startups that do exactly that in the intersection of mental health and AI. This is something that, I cannot say much about it, but I'm a scientific advisor to Research Labs, and they tackle exactly that problem of supporting clinician burnout with AI. This is something that I've been involved with across different organizations, such as well International SOS, providing support to clinicians in different areas who struggle with compassion fatigue and burnout, and being able to really share these insights with them to make sure that they better their health and their family's health.
Thank you. So what's next? I guess the platform being in development, that's your main baby at the moment, the thing that you're working on. But is there anything else on the cards going over the next 6-12 months that you're looking forward to, or you're working on, or you're excited about?
I'm working, and I keep, I would say, adding on to my portfolio different companies that I'm advising. And I joined as a partner in a venture. I'm a partner at Unlock Pacific Ventures, a venture firm. And so I hope that I can also start supporting innovation. And because, again, funding is a very significant component of being able to launch the products, to bring them to the public, to share the innovation and better the healthcare field as a whole. I'm very, very excited about that as well.
Thank you so much for joining me this afternoon. It's been a really incredible conversation. So thank you for pulling back the curtain on such a complex issue. I think it's really exciting to see a solution that isn't just plug in tech for tech's sake, but actually really respects the relationship between the therapist and the client. So thank you for sharing. Thank you for telling us about your practice. And I wish you obviously all the best with the development of the platform and your endeavors going forward.
Thank you so much. Thank you for having me here.